And then we're going to go ahead and get started. So if you three want to introduce yourselves, that'd be great. And we can go ahead and get started. Thanks, guys.
Yeah, thank you, Dr. Ensign, for the introduction. I'm Elena, one of the pharmacy students speaking today.
And my name is Ken. I'm one of the other pharmacy students speaking today.
Hi everyone, I'm Christy, really excited to be here today. And
Perfect. So just to get started, we'll go ahead and Christy, can you get the next slide, please? I think one back. Perfect. So just to start off with just the main general question, what is diabetes? So it's a condition where sugar builds up in the blood. This can happen in two different ways, which we'll discuss further, which helps further differentiate between type 1 and type 2 diabetes. But basically, it's just when the body doesn't make enough insulin or can't use it properly. And so really think of insulin as kind of like a key that helps the sugar either leave the blood and go into the cells to be stored into energy. And so if anything goes wrong with this insulin, for whether the body doesn't make enough or anything like that, that's when this condition can actually come up. And so insulin, it's made from the pancreas in things called beta cells, which we'll go into further too. But so as we eat, our blood sugar then goes up. And so we need the pancreas, those beta cells, to then make the insulin and have that then move the sugar into the cells. And so that's why insulin is essential and can be the contributing part to diabetes. And so if the balance between, as mentioned in the slide, insulin and blood sugar is disrupted, this can lead to long-term complications and sometimes short-term. So some short-term complications that people can see are just sort of symptoms, which we'll delve into further, is just being thirsty or having to urinate a lot. Someone may be feeling tired. So this is when the sugar stays in the blood instead of moving into those cells. So the insulin isn't working properly. And so it can cause these sort of symptoms. And then for longer term complications, that you can see can be eventual damage to things in our body, such as our eyes, kidneys, nerves, and even the heart. And so it's very important with diabetes to make sure there's really good management of this condition in order to at least prevent these long-term and short-term complications. And so for looking at diet with diabetes, this can kind of be a tricky one since oftentimes with just a lot of different foods today, there are a lot of sugars in them, whether we actually realize it or not. So this topic does get a little tricky. We did put some just images here that you can find on the internet for just healthy plate options or just diet for people with this condition. So just to go into it, so again, food will then turn the sugar that we eat into carbs, or especially carbs we have to look out for. So when the sugar then goes into the blood, it can spike our sugar levels, and so that can cause some of those short-term symptoms that I mentioned from before for those sugar spikes. So feeling sick, sometimes patients with this condition can feel dizzy or tired. And so making sure we're eating or having people with this condition have balanced diets and food portions throughout the day can help stabilize and keep the blood sugar stable throughout the day. And so this will be less highs and lows and more of just stable energy and mood. And so some foods that we did list here to just sort of avoid, and along with drinks as well, would be soda. This has a lot of sugars, so this could lead to a lot of sugar spikes. Same with fruit juices. Even though it does say like natural sugars or anything like that, sugar is still sugar. And so oftentimes with these fruit drinks, this can be another big thing to want to avoid for people with diabetes. And then anything that are baked goods, there's a lot of added sugars. And then same with the cereals with the artificial sugars. And for things with carbs, anything like white bread, pasta, rice, bagels, this can actually lead to some of those symptoms as well. And so just wanting to avoid these foods mentioned and actually try to go for more of a green or like colorful plate is what we're constantly emphasizing here at the pharmacy school. So just making sure we have good portions of trying to get our vegetables daily, our fruits, proteins, whole grains. And so when we say whole grains, stuff more like brown rice, whole wheat bread, and then with the proteins, just any sort of chicken, turkey, eggs. So these choices are definitely more strongly recommended in order to avoid those spikes in sugar. And so for going into the question of how does insulin work, we kind of talked about it in the very beginning. But again, as insulin's kind of just the key for having the sugar that's in the bloodstream enter and go into the body's cells. So we do need the insulin to help move this and facilitate this process. And so mentioned here, we have beta cells in the pancreas. So this is what makes the insulin move into the cells and for storage and for long-term use. And so the production of insulin also will stimulate other beta cells that are in the pancreas to make more insulin and keep up with the demand to lower blood sugar. And so when we consume any sort of food, the body then senses that sugar and then it's going to produce that insulin. And so we do mention here just the two types of diabetes. So there's type 1 and type 2. For type 1, it's when the immune system destroys the beta cells that produce insulin. And then for type 2, this is when the body becomes resistant to insulin and the pancreas tries to make more, but over time digresses and less insulin is made. So for the key thing for type 1, that key of insulin isn't made. And so this is due to the immune system actually destroying those beta cells. So again, for type 1 diabetes, this is a life-threatening issue that patients do have, and this does need treatment. And we'll go into it furtherly in the further slides progressing, but it's just that the body doesn't make any insulin at all. And then with type 2 diabetes, it's more so that the body does make insulin, but cells aren't really responding to it as well. So this is a term that we call insulin resistance that we'll elaborate further on. So at first the pancreas will try to make, or it's actually going to work harder to try to produce that insulin, but over time the pancreas is going to kind of like wear out and make less insulin. And so people with type 2 diabetes, they might need pills or insulin depending on how advanced it is. And then people with type 1 diabetes, they're actually going to require insulin every single day due to this lack of insulin being produced. And so type 1, type 2, to go further into it, we do have this diagram here, which everyone, you can just take a look at. I feel like this does a really good differentiation between the two. But again, type 1, it doesn't make enough insulin. And then type 2, the body's not really responding to it, as I mentioned from before. And so for type 1, the body's immune system is attacking those cells that make the insulin, the beta cells, so no insulin's made. This does happen young or in childhood, and symptoms do come on quickly. So for the symptoms here that are kind of showing, it's those thirst, the tiredness, frequent urination. And so individuals with this type of condition, you'll see those. And so that's why insulin injections or an insulin pump every day is actually needed for treatment. So it's not optional, it's actually life-saving in this condition. And so with type 2 diabetes, on the other hand, the body doesn't use insulin well. And so it's not really responding to it. There's that insulin resistance that I mentioned here that does occur. And so it affects usually adults, but because of the current lifestyle, sometimes genetics, and then just diet from every day, it actually has been seen more prevalent in children getting it because of their lifestyle. And so it does happen slowly over time. So patients can have the symptoms or be asymptomatic or just slowly progressing. And then for some of the causes, it is just again linked to genetics, diet, weight, and then family history. And so for this one, we usually try to treat and start with just non-pharm therapy. So just anything with diet or exercise changes. And then if needed, we can add oral medications to help the insulin work better. And then in in other situations as well, we might need to add insulin injections later for just better control. And yeah, so that's just kind of more so in depth when you hear an individual that has diabetes and you find out whether it's type 1 or type 2, then you hear that, you'll now kind of be able to have a better idea between which one is which, but then also which type of medications you could honestly try to think that the patient would be taking according to their condition. And so from that, we'll go into just the blood sugar testing guide. This is definitely something that we recommend and that people with diabetes do have to do frequently, type 1 and type 2. So we did make this chart here that you could just take a look at, that I'll just kind of be pointing out some things. So we have the different diabetes types and treatments, and then usually when it's recommended to test, and then how often. So how would you test the blood sugar? So it actually will involve a finger prick. The main thing here that I do want to highlight on this slide is that for finger pricking, we do have a lot of nerves and actually more blood vessels on the sides of our finger, but more nerves on the actual point. So that's why it is directed and instructed to actually prick the finger on the side where these blood vessels are more located, not so much at the tip because that can be more painful since we do have more nerve receptors there. And so that's the main thing that I just wanted to mention here on this slide for when pricking a finger for doing blood sugar testing. And then also here for type 1 diabetes, it's more often. So this will be times of before or after meals, and then sometimes at bedtime, and then also it could be if it's indicated by the doctor at 2 or 3 a.m. But usually all these indications will come with the actual prescription when prescribed from the PCP, primary care physician. And then we have the type 2 diabetes, so it's also recommended to test blood sugar as well during just different times listed. And then for a continuous glucose monitor, a CGM you might hear, that's when a patient has a glucose monitor actually like in them, so it's actually being able to constantly monitor those blood sugar levels, the spikes and lows, which some patients might have if you do hear of that. And so when we are, or just what's the significance of testing the blood sugar? It's because it's to see when any individual is experiencing highs or lows of that could be indicating like the low blood sugar or high blood sugar. It's really good to just be testing the blood sugar so then you can be able to monitor how much blood sugar is currently in the bloodstream. And then also if any patients are experiencing any sort of symptoms, anything like that, this would be another good indication as well. And so it's just like how for anybody that has a blood pressure medication or has high blood pressure, we want to constantly take the patient's blood pressure daily and kind of log it. It's the same idea here with blood sugar testing as well. So that's what's something that is very important for individuals with both type 1 and type 2 diabetes to do.
So in terms of blood sugar readings, it's really important the timing of the day because the blood sugar levels can change throughout the day. What may look like a high or a low depends on when the reading was taken, what was eaten, and the medications that were used. Being able to distinguish between normal and critical is also really important. Normally, we expect a range of like 80 to 130 milligrams per deciliter, normally before meals. And in terms of like any caution zones, anything below around 70 or anything above 250, you want to be able to monitor that. And then for critical levels is when it's less than 40 and greater than 500. And for those situations, emergency is indicated. And there are situations where you expect you start to experience like morning highs. This could be because of a thing called the dawn effect, where the body releases hormones like cortisol and growth hormones early in the morning to help you wake up. These hormones can help raise the blood sugar levels. And also there's another effect called the samogi, where the blood sugar drops too low during the night and then the body releases hormones. But sometimes it can overcompensate and causes like a morning high. And some things you want to ask yourself is like, when was the last meal taken? As we mentioned earlier, when and what someone eats directly impacts their sugar readings. So meals like high in simple carbs, like white bread or sugary snacks, can cause big spikes. Late night eating can affect morning numbers. You want to make sure, like, because in terms of like the Somogi effect, if someone doesn't eat in the night, their blood sugar can drop too low, and then the hormones will compensate it by increasing the blood sugar levels, causing these morning highs. And you also want to reflect on what medications they are currently taking. So are they using insulin or any oral medications? What time did they take it? What type of insulin is it? Is it short acting or long acting? We'll dive into those medications in a couple slides. But knowing these details can help figure out if your glucose readings make sense or if something needs to be adjusted. And in terms of how to measure a long-term reading of your blood glucose is called the A1C. It usually tells us about the blood sugar over time. It's kind of like a blood sugar report card where it's not just showing a reading in terms of the finger stick. It shows the average blood sugar over the last 2 to 3 months. So the A1C measures how much sugar has been stuck to the red blood cells. And the more sugar stuck, the higher the A1C number. And this number can help doctors or pharmacists know how well the diabetes is being managed long term. If the person's diabetes is well controlled, then you want to check their A1C about twice a year or every 6 months. If there's any treatment changes or the blood sugar isn't really well controlled, then you want to check the A1C every 3 months or 4 times a year. And on the bottom table we have here, it just kind of summarizes what you want to be aiming for. So the A1C less than 7%. And when before meals, you want to target a range of like 80 to 130. And then after meals, something less than 180. And on the right is another table of just what the interpretation of the A1C levels can mean. So since we're targeting a A1C of less than 7, that's about anything less than 154 on average, or if it's A1Cs at 7%, then the range is like 123 to 185. And then how to handle low blood sugar, which is also known as hypoglycemia. So low blood sugar means there's little sugar in the blood, which the brain and body needs to work properly. So some symptoms you might experience in terms of low blood sugar is like shaking or trembling, faster heart rate, extreme hunger, sweating, confusion, difficulty concentrating, dizziness. And if you suspect any of these symptoms, you want to use the 15-15 rule, where you give 15 grams of sugar from sources like juice, glucose tablets, or fruit snacks. Then you wait about 15 minutes, and then you check your blood sugar again. And if it's still under 70, you want to repeat these steps all over again. And on the bottom is a table of just the different levels you might expect when you're experiencing hypoglycemia in terms of like the blood glucose readings. So as we mentioned, level 1 is when the blood sugar is low, which is from between 54 to 69. These are the situations where you would do the 15-15 rule. Level 2 is when it's under 54. You want to give sugar fast. You monitor them closely and then possibly some medical help. And then level 3, these are the serious symptoms where the person might be experiencing a lot of confusion. They possibly pass out or they can't help themselves. So you want to call 911 and give emergency glucagon if trained to do so. So diving into that 15-15 rule, it's really good to be prepared for situations of low blood sugar. Being prepared can prevent any scary situations, and you should know the signs of low blood sugar and be able to act fast. So always have a fast-acting sugar source nearby. Some of the examples are like fruit snacks, gummies, granola bars, or lifesaver candies. One small piece of fruit, such as a half a banana, 4 ounces or half a cup of juice, or regular soda, not diet, 1 tablespoon of honey, sugar, or syrup, a tube of instant glucose gel. There will be instructions if you happen to use that kind of situation, and then 3 to 4 glucose tablets, and also we'll be having instructions if you get those. Just think of it like it's like an EpiPen, but for blood sugar, you don't have to use it. You don't use it every day, but when you do, it can make a huge difference. So having all those resources is really, really important to have. And then how do diabetes medication works? There's many different medications for diabetes. Some of them help the body make insulin, others help the body use insulin better. and some help remove sugar from the body. So we have like insulin injections that help replace or replenish insulin in the body. These are your insulin. It'll be labeled as like Lispro, Aspart, regular insulin, NPH, Detamir, Glargine, and these can range from like rapid acting to long acting. There's common medications that directly help the body make insulin. These are your sulfonylureas. They usually end with like glides or like glyburide, glipizide. There's the maglinotides, which also end in glinides, so maybe medication like replagonide. Some other common medications that lower blood sugar in other ways is metformin, which helps the body use sugar better. And then there's the DPP4 inhibitors. Those usually end with the gliptin, like sitagliptin. And then there's the TZDs. It's a really big word. I'm trying to say it as best as I can. Thiazolidinones, I believe, but they end with glitazones. So something like pioglitazone. These medications help the body respond to insulin. And then we have the GLP-1 agonists, which normally end with Tide. These are the more ones we see nowadays, like semaglutides, in other words, like Ozempic, or the oral form, which is like Rybelsus. These slow digestion and reduces hunger. And then there's SGLT2 inhibitors, which end in flozin, which helps the body get rid of sugar through urine. These are like empagliflozin, dapagliflozin. And then there's images in the slide too that just show what they possibly look like in real life, or if you have seen them before. And when your patients are getting these medications, you want to ask yourself, like, what kind of medication is this? Knowing whether it causes like low blood sugar helps with meal and snack planning. Always read the labels and ask the pharmacist when and how to take them. And be alert for any side effects like nausea, swelling, frequent urination, and report any of these concerns to the doctor. And we will dive into those when to contact the doctor in those situations.
So, here are some things that might be helpful to look out for in someone that's new to insulin or just starting on it. There are various different types of insulin, like Ken mentioned. Some of them are going to be shorter acting and some are longer acting. The reason is that the insulins can work for different lengths of time, and the way that they're prescribed, normally it's to try to mimic the body's natural production of insulin in response to meat in food intake or meals, or just like normal baseline levels. So like rapid and short acting insulins are normally going to be taken before meals. And then longer acting ones can be taken like once or twice a day to help maintain baseline insulin levels over like a full day. And because of this, there are a lot of different insulin regimens that you might see consumers be on, whether it's using it once or twice a day or up to 3 to 4 times a day too. In terms of how to inject properly, there's a photo on the right and it shows the proper injection sites in color. Normally, we recommend injecting in the abdomen or the stomach, and also rotating the injection sites when you are when you are telling people to inject. So if I was going to do my stomach, I would split it into 4 quadrants, and then every week I'd be rotating which quadrant I'm injecting in, just to make sure that I'm spacing the injections apart, not too close together. Make sure the injections are about 1 inch apart from each other. And the reason we're doing this is to avoid lipid dystrophy, which is an abnormal fat distribution. And you could see this in, it might show as like lumping kind of, or like thickening of the skin in the area that you're injecting. And this is something that we want to avoid just by rotating the sites. There's also proper injection technique, which comes with cleaning this skin where you're going to inject with the alcohol pad right before, and making sure to let it fully dry. Pinching the surrounding skin so that when you're injecting, it gets into the subcutaneous tissue, and then not reusing needles, only use them one time and dispose of them in any puncture-proof container after, like a detergent container or a sharps container. And then insulin comes in pens and syringes. So pens are kind of easier to use, because with syringes, you have to draw it up from a vial, but it's pretty much patient preference or also like availability of the drug that they're being prescribed. With insulin, it's really important that consumers are regularly monitoring their blood sugars. We want to make sure that they're keeping track of how it can change based on their insulin doses or based on what they eat, and also that they're aware of hypoglycemia, which is one of the most common side effects of insulin, since you are just dropping that blood sugar to control it. Making sure that they're aware of that and the 15-15 rule. And then for storing insulin, if it hasn't been opened yet, we leave it in the refrigerator. Once it's open and being used, it can be at room temperature, normally for up to 28 days, but it can vary. So making sure they're checking the label and writing down when they opened it is best practice. And then when should a provider or pharmacist be contacted? If consumers notice hypoglycemia that is not improving, so it's still under 70 milligrams per deciliter even after treating it with the fast-acting sugar, or if the hypoglycemic episode involves confusion, fainting, or seizures, those are definitely more worrisome and could be or definitely warrant talking to your provider about. It could be because their insulin dose is too high or their other diabetes medications, or the eating and exercise patterns need adjusting. Hyperglycemia that persists is also a reason to contact the provider. Normally, if it's over 250 while they're still using insulin, that's a little higher than we'd like to see it, especially if it's accompanied by symptoms like having to use the restroom a lot, being really thirsty, having nausea, vomiting, or abdominal pain are more alarming. So if there are signs of infection or wounds that are not healing, patients with diabetes can have slowed wound healing. So it's definitely something to be on the lookout for, especially around the feet area. If people are starting new medications, it can also be worth it to talk to the pharmacist about how it might affect their current regimen. If there are any drug interactions they should look out for, how it might affect their blood sugar, and any dosing considerations that might need to be taken, especially for patients on insulin or sulfonylureas. And then overall medication side effects. For injectable medications, if there's rash, itching, or swelling around the injection site, normally it'll go away within like the first 2 weeks of using it. But if it persists or it's bothering you, then definitely contact your doctor about that. For oral diabetes medications, normally they're pretty well tolerated. People do experience like upset stomach or constipation or dizziness. And that's when we want to make sure that they're testing their blood sugar for hypoglycemic episodes. But overall, if the side effects are bothering them, then it definitely warrants talking to a provider. And then with insulin, some people do notice weight gain or swelling of like their like around the feet, ankles, or like other limbs. So if you do notice that or it's bothering you, then yeah, talk to your provider about that. Overall, anything that would make someone not want to take the medication regularly or how they should, we definitely wants to be addressed, since it's more important for people to be on their medications than not. And then overall, what we can do to support diabetes care, like Elena mentioned, everyone has recommended lifestyle interventions. So that includes eating healthy and regular physical activity. It's really important to try to make it as consistent as possible and just encourage the people that you're caring for that you're like recognizing their efforts, because it can be really hard like being told not to eat the things that you don't want to eat. Just finding something and trying to put the effort in that like to find something that works for them in terms of like physical activity, like as long as it is they're doing the best they can, that's what we want to see. And then adherence to their medications, really want to make sure they're taking it to prevent those, not just to control their glucose, but to prevent all the complications. And then some more general tips. When it comes to checking blood sugars, we're really trying to encourage people to keep a log of their blood sugar levels when they take it, if they've eaten or not before the measurement. And then like what they might have eaten would be a helpful thing to write down too, to try to find patterns in what can spike their sugar levels. And then reporting side effects, trying to give medications at the same time every day for consistency and routine. And then also making sure that their care for diabetes is comprehensive. So that includes going to get your eyes checked, to get your feet checked, and getting your vaccines. Overall, the good news, diabetes is manageable and your support makes a big difference. We're really glad to be available and to be supporting people that are actively like coming out to things like this to learn more about what they can do. And we always want patients to rely on the care team and all the providers that you guys have around you. So please feel free to let us help. If there are any questions, feel free to ask. But other than that, thank you guys for coming.
Thank you guys for coming out and listening to us present today.
Is there
Yep.
any way that you guys can share with us your PowerPoint?
Yes, we'll be posting the recording, and I think Dr. Ranson will and Dr. Lazaro will send the slides too.
Thank you.
Yeah, so what we'll be doing is posting the lecture content from all 4 of our lecture series, including this one, as well as the recordings. Dr. Lazaro will have them available to you guys. Probably these 2 will be available pretty soon, but absolutely we're happy to share this with you guys.
Thank you.
Any other questions from anybody? And Christy, if you want, you can go ahead and stop the recording as well.